I was often embarrassed by the way people would react to my veins. I always covered my legs.
I was certainly self-conscious, being out in public with shorts at a public event where I'm walking around with friends.
If you experience discomfort, swelling, and varicose veins in your legs or ankles, you may be suffering from superficial venous reflux disease. Approximately 25 million people in the United States suffer from this condition. Varicose veins are caused by damaged valves, which result in backward flow of blood in your legs, a condition known as venous reflux. This can cause blood to pool in your legs and lead to symptoms such as pain, swelling, and varicose veins.
What it's like having varicose veins at the young age that I had them is like being an old lady before your time. You get tired easily, you have a lot of pain, your range of motion is somewhat limited. My legs were swollen.
The symptoms I experienced were pain in my right thigh, some muscle cramping, and bulging veins in my shin and calf. It was really bad.
Superficial venous reflux disease can be progressive. Symptoms may worsen over time if left untreated. By seeking treatment, you have taken the first step toward recovery from these painful and unsightly problems. Traditional vein stripping surgery has been the only option available to treat venous reflux, an underlying cause of varicose veins. Vein stripping includes incisions at the groin and calf. A stripper tool is threaded through the diseased vein, and the vein is then pulled out of the leg. This can result in pain and bruising for the patient during the 2 to 4 week convalescence. Now patients can be treated with the closure procedure, a minimally invasive alternative to vein stripping surgery. Closure utilizes radio frequency energy to heat and seal the veins shut. In one report, 98% of patients surveyed who have undergone the closure procedure are willing to recommend it to a friend or family member. Recovery time is very short. Most patients return to normal activities typically within a day. If your physician feels that you are a candidate for the closure procedure, here is what the preparation for the procedure will be. Using ultrasound to scan your leg, your physician will determine where superficial venous reflux is present and map your vein. The closure procedure is performed on an outpatient basis. Using ultrasound, your physician will position the closure catheter into the diseased vein through a small opening in the skin. The catheter delivers radio frequency, or RF energy, to the vein wall. As the RF energy is provided and the catheter is withdrawn, the vein wall is heated, causing the collagen in the vein wall to shrink and the vein to close. The closed vein is left in place and over time is reabsorbed by the body. Once the diseased vein is closed, the blood is rerouted to normal, healthy veins.
My experience with the closure procedure was exactly like my physicians told me it would be, every step of the way.
The closure procedure was very comfortable for me.
There was no pain, no throbbing, no numbness, none of the things that they said might happen. Nothing. I felt perfectly fine. I mean, I was ready to get out of bed and walk out.